Hello, my name is Lauren, and I'm going to demonstrate how to assess the thorax, cardiac system, and abdomen. I'm going to start out with the thorax. First, I'm going to inspect the chest. I'm looking for symmetry, which he is symmetrical, his shoulders are symmetrical, and take a deep breath for me. And his chest is symmetrical with inspiration and expiration. His breathing seems to be effortless and not labored. There's no impairment in his movement at all, and I don't observe the use of any accessory muscles when he breathes, which means his diaphragm is working properly. Next, I'm going to palpate for any crepitus, any kind of air trapping in the chest, and I don't feel anything like that. Is there any tenderness? Okay. Next, I am going to palpate for tactile fremitus, which is I'm going to be feeling in between the ribs and the intercostal spaces, and I'm going to have my patient say 99, and I'm feeling for the vibrations, which should be symmetrical on both sides. So I'm going to use the palm of my hand. You say 99?
99. 99, 99, 99, 99, 99, 99, 99.
Okay, and he's symmetrical on both sides. Next, I'm going to percuss anteriorly, and I'm going to auscultate anteriorly, and then I'll go to the back and do that posteriorly. So first, percussing anteriorly, I'm going to, again, feel in between the intercostal spaces, and I should hear tympanic sounds. If I was on a rib, it would be dull. Or if there was any fluid in the lungs, it would also be dull. Lastly, I'm going to auscultate anteriorly, and then I'll switch to the posterior. Can I have you take a deep breath in and out each time? Okay, and I don't hear any wheezing or rhonchi or any kind of congestion. Okay, I will now percuss and auscultate posteriorly. I'm going to avoid the scapula and again go in between the ribs, and it should be tympanic. Okay, now I'll auscultate. If I can have you take a deep breath again. Okay, if I can have you put your arms like this, and I'm just going to listen laterally. And the other side. Okay, that's good. And one last thing to check for equal expansion, I'm going to feel in between T9 and T10, and I'm going to push in and I'm going to have you breathe, and then my thumbs should expand equally with your chest. So go ahead and breathe in. Okay, and it looks good. And that concludes my assessment of the thorax. I'm now going to assess the cardiac system. I'm going to start out with jugular vein distension. If I can have you turn your head to the left. I've got him at a 45-degree angle here, and I'm assessing for any pressure with the jugular vein, and then also for the pulse, and I can see it down here at the bottom. I'll go ahead and have you turn your head back this way, And I'll palpate that pulse. And then the other side, and I'm going to do one at a time with the carotid, as to not occlude. Okay, I'll go ahead and go on down and assess the brachial pulse. Make sure they're equal. And then the radial pulse. Okay, and that looks good. Next, I will palpate for the point of maximal impulse, and that is going to be at the 5th intercostal space. So I'm going to feel down 5 intercostal spaces, and then mid-clavicular. So I'm going to go over here, and I do feel that point there. Next, I'm going to inspect, palpate, and then auscultate the aortic, pulmonic, Erb's point, tricuspid valve, and mitral valve. So I'm going to start out with the aortic, and the aortic is going to be 2 intercostal spaces down, and I don't see any kind of pulse on the surface there, but I'm going to go ahead and palpate and then listen. Okay, and then I'll go ahead and feel for that pulmonic. And then Erb's point is down at the 3rd intercostal space. Okay. Tricuspid is the 4th intercostal space. And then finally the mitral valve, also the PMI, is the 5th intercostal space. And that concludes the cardiac system. Next, I will assess the abdomen. First, I will inspect the color, and I don't see any yellowing. His color is appropriate for racial background. Next, I'm going to look for vascularity of the skin. I don't see any bruising or any kind of pooling of blood, no veins that stick out. I also don't observe any lesions or any kind of rashes. The contour of his abdomen is bilaterally equal. I can see that it's rising and falling as he breathes equally. And I don't notice any peristaltic waves or any abnormal pulsing of the abdomen. Next, I will auscultate for bowel sounds. I'm going to auscultate each quadrant, starting with the upper left. And about 5 to 30 bowel sounds per minute is normal. And I can hear that his bowel sounds are active. Next, I'm going to auscultate for a friction rub over the liver and spleen. So I'm going to use the bell of my stethoscope and listen for any friction rub or bruise. Listen with diaphragm now. And last, I'm going to auscultate for bruits over the aorta and renal artery. So the aorta, I'm going to auscultate right over the umbilicus with the diaphragm and the bell. And then the renal and iliac arteries, they branch down from the aorta. And I'll listen again with the diaphragm. Okay, next I'm going to percuss. To percuss for the liver, you start at the umbilicus and move your way up and listen for the tympanic to turn to dull. And when you hit the dull sound, then that is when you've reached the bottom border of the liver. So just percuss until I hear that dull sound. Okay. And then to find the top of the liver, you're going to do the same thing in the intercostal spaces. So you hear that dull, and that's the top of the liver. Now, for the spleen, you're going to do the same thing, just moving up on the side here. Next is light palpation, and I'm just going to cut the abdomen into 4 quadrants and start out with light palpation and ask if there's any tenderness or pain. And then go into deep palpation from there and just feeling for any abnormal tumors. Okay? And then I'm going to palpate the liver and just palpate for any enlargement. And then the same with the spleen. And then for the kidney, you want to push down and feel the underneath. And then the same on this side. And then the bladder is going to be in between the umbilicus and the pubis. And the only way you'd be able to feel that is if it's distended. And you're just going to feel the upper part of the bladder. And that concludes the assessment of the thorax, cardiac system, and abdomen.